Hi there, folks. Today we are going to talk about why you should sponsor our healthcare program for the elderly. But first, let's go over some key points that we're going to be talking about. Okay, so there are 5 main points that we will be going over. Point number 1, we'll be talking about the special population. Point number 2, we'll be talking about challenges our special population faces. Point number 3 is addressing why it can be difficult for our special population to address their needs. Number 4 is to break down some of the health problems that our special population actually has. Number 5, we'll just be explaining some extra details on what our clinic will be like. Point number 1, special population. Our main focus and goal through this wellness program is to make healthcare cheaper and more accessible to elderly people. Point number 2, health challenges our special population faces. As people age, they start to have higher risks of getting diseases and illnesses. For example, 80% of heart failure patients are over the age of 65. The Centers for Disease Control and Prevention reported that just over 71% of U.S. adults that are over the age of 60 had hypertension. And according to the American Diabetes Association, 1 in every 3 elderly people have diabetes. Studies consistently found that a significant majority of arrhythmia patients are elderly. Point number 3, why it can be difficult to address health problems in elderly people. One of the reasons it can be difficult for elderly people to address and actually take action on their healthcare needs is the money. A lot of elderly people do not work because of their age or just the physical state that they are in. Another reason may be that they don't have transportation to get to their healthcare provider. Another reason may be that they don't want to burden their family with their health conditions. Point number 4, breaking down some of the health problems that our special population has. Hypertension is the force of blood flowing through the blood vessels is consistently too high. And the specific concern for our special population with high blood pressure can be that high blood pressure is often linked to other health problems. Usually people don't know they have high blood pressure. That's why it's called the silent killer. Now I'll put up an image for the different measures of blood pressure and what is considered high and what is considered low. Our program, our wellness activity for treatment would be a variety of choices. Some of the things that the patient can do could be to take meds, to change their diet, to work out, or to just change their daily lifestyle habits that will help to reduce hypertension. We will try to help check the blood pressure every day or as many times through the week as we can. Another health condition we will focus on is type 2 diabetes. Type 2 diabetes is when the body does not use insulin effectively or does not produce enough insulin. The specific concern for our special population with type 2 diabetes is that it can cause heart failure and heart arrhythmias along with other things. Now for the symptoms, I'll pop up a photo just showing and explaining some of the symptoms for type 2 diabetes. Now, the diagnostic criteria for type 2 diabetes can be determined through various blood and glucose tests. I'll also go ahead and pop up an image for that. So for our wellness activity for treatment would be healthy lifestyle changes like eating a balanced diet, limiting sugar and processed food, and switching to whole and organic foods and natural sugars. So our metrics for measuring client progress to at least ensure they are maintaining or getting better would be to log every meal, snack, drink, and everything that you consume and see if results are getting better over time. Our next condition is going to be heart failure. Heart failure is a chronic progressive condition where the heart works less efficiently than normal. Our specific concern for the special population is that elderly people deal with heart failure a lot. 80% of heart failure patients are elderly people. And now there's also a long list of symptoms, so I'll put up a photo. Diagnostic criteria for heart failure can be determined through various tests and examinations, such as blood tests and chest x-rays. To treat it, you would have to see if there's a specific condition that is causing the heart to fail, and if so, you would target that condition to reverse the heart fail. You can also make lifestyle changes, take meds, or you can get a surgery for heart failure. And then the metrics for measuring client progress would be to redo the various tests and see if you made progress or if you at least maintained the state that the patient was in. Arrhythmias. A heart arrhythmia is an abnormal heart rhythm caused by a problem with the electrical conduction pattern of the heart. And then the specific concern for our special population is that arrhythmias can be directly related to other conditions such as hypertension, type 2 diabetes, and heart failure. And then once again, these symptoms are kind of long, so I'll just pop up a photo showing a couple of them. And the diagnostic criteria is identifying a abnormal heart rate with various tests, and one of them is electrocardiogram. And then the wellness activity for treatment is that the treatment is aimed at the type of arrhythmia that is present, but to prevent complications such as blood clots and returning heart rhythm back to normal and regular checkups with your doctor. The metrics for measuring client progress is redoing the test and trying to make sure rhythm is back to normal and does not get worse. Point number 5, what the clinic will be like. To best suit our patients, we would choose to have a mobile bus clinic. I have experienced this firsthand with my elderly family. Oftentimes, elderly people don't want to feel like a burden and ask people to drive them to the doctor and other places, so we would come to them. Staff we would need for our mobile clinic would be nurses, medical technicians, supervising cardiologists, and a ECG technician. Our staff would be paid and volunteered, but most likely more paid than volunteered, just for the areas of places we would need people. And just as far as the different grants go, Indiana's Medicaid programs and the Indiana Pathways for Aging waiver. Hope you enjoyed, and I hope you have a blessed day.